Anyway, welcome to the Gyaff. So nice to have you, Nelece. Jaundoo.
Yeah, yeah.
Is it
But
Jaundoo or Jaundoo?
Jaundoo.
Jaundoo.
Mhm.
Okay, Jaundoo. Well, thank you for coming.
Well, thank you for having me.
Yeah, I appreciate it. We love to have, you know, different perspectives, and especially because I guess I always have something to learn with every guest that comes, especially women, because I'm so constantly trying to understand the female perspective. So to talk to someone like you, especially in your field, super interesting, which we'll get into. But uh, just for the benefit of my viewers, can you just tell me a little bit about yourself?
Where do I start? I am a dental surgeon by profession, and my focus, my specialty is facial aesthetics, basically aesthetic medicine.
Oh, dental surgeon,
Yeah, yeah.
but now you're specializing in facial
Yeah.
aesthetics.
So, studying dentistry or medicine, it is one of the prerequisites to getting into something like facial aesthetics.
Okay.
And so that's what I decided to do. I think I thought a lot about what I wanted to do, and I think that this just it combined everything that I love, like art, beauty, science. Like I was a big science geek, but I also really love fashion and beauty and art and skincare, and I feel like this
Yeah.
just gave me the opportunity to do all of that in one career, and so I'm like so happy that I found it.
Yeah. Well, you look very well put together, if that's any testament to your chosen profession.
Thanks. This is my default.
Yeah, nice. Well, so you're talking about that's actually interesting. Sorry, before I get into my line of questioning, where'd you study?
So I studied my dental surgery program. I studied here in Guyana,
Okay.
and facial aesthetics, my specialty. I studied in the U.S. in Boston.
So the dental part, the dental part of your medical history, it was you did that at UG.
Yeah, yeah.
Where'd
I
you go to
did.
school?
At UG.
Sorry, before in high school. I'm talking
In
about.
high school? Oh,
Yeah.
so actually, I'm from Berbice.
Oh, okay.
Yeah,
What part?
yeah. Skeldon.
Oh, no way.
Yeah, yeah. So I grew up on the border of Guyana and Suriname.
Awesome.
Yeah, yeah. So it was an interesting place to live. So it was fun. I love it so much.
What's your favorite thing about Berbice?
So my house where I grew up is right by the river, and that was one of my favorite things. Like I'm a morning person.
Quarantine
so,
River?
Yeah, yeah. I'm a morning person, and so I loved waking up. When I was younger, I would wake up at like 5 in the morning and look at the sunrise. It was completely unobstructed, and I'd see the sun rising over the river. And back then, I would enjoy photography a little bit. I'm no pro, but I just love taking pictures of the sunrise. Sometimes just doing yoga outside
Oh, nice.
in the mornings. And it's so close to Suriname that if I used a pair of binoculars, we could see everything over there.
No way.
Yeah, yeah.
I
yeah.
assume the countryside there must be super peaceful at certain times.
It is. It is.
Yeah.
It's a lot of people ask, was it really challenging or was it really boring growing up there? Because there's not a whole lot of structured activities to do or extracurricular things, but I feel really grounded in the way I grew up, and I enjoy it so much. I wouldn't change it for the world because I feel like just being there and experiencing all the things I did, that sort of made me who I am.
Yeah.
And it kind of helped set the tone for the way I wanted to live my life. For example, like my mom was she was really strict, I'd say, about how we eat. And it was no sodas in the house. And everything you eat had to be like you had to be able to name it. It was all just like freshly made, just whole foods, and that's something that I still do now as an adult. Like I love being mindful of how I eat, and so
Yeah. Our generation, for the most part, I think, doesn't really appreciate like where they came from or like the experiences they had growing up. And I have the people I do speak to from like the I don't want to say rural areas. That sounds kind of, but like the non-Georgetown areas, you know, they have a really deep connection to like Essequibo Coast, for example, or you know, just the West Bank. They, I feel like they rep their home hard, you know.
Yeah,
And
yeah.
I love what you said about your mom and her, even though she's being strict, because my grandma, who I grew up with, was quite strict on me too. About I was a fat kid, but but she used to be very strict about what we'd eat, and I think like those sort of habits that she pushed from a young age sort of pushed over into my adult life, you know. So
Yeah.
like I could really tell when I'm not eating as I'm supposed to, or my body knows like what's going on. And I think those things are like so important, man. We take that for granted. Like those are like the
No,
foundation of who we are, you know?
you're exactly right because I feel the same way. What we eat, you know, it tells our bodies how to behave, you know, and food is so important. And these days, you have to worry so much about what you eat and what's in it. And so I'm so happy like that this was something that stayed through, you know.
Yeah.
And it's the same thing for me. The moment I eat something I know I'm not supposed to, and my body starts to scream. It's like, what are you doing to me?
Yeah. Especially Lord knows we're surrounded by like all these things that are terrible for us these days. Cheap fast food and
Yeah.
you know, so it's good to have that like that biological like compass to like sort of guide you back. But yeah, no, that's crazy. So one more quick question on Berbice, like what was like childhood like growing up there, and sort of did you have a lot of friends, or what do people in like those communities in Berbice, like Skeldon, you know, what do kids sort of do like with their childhood?
My experience was we played outdoors a lot.
Yeah.
I had tons of pets growing up, cats and dogs. I loved them so much. So we always had a pet at some stage or two. And so we would be outdoors a lot. The kids, like our neighbors, we would all just play with each other. I remember like one of the rules my mom had was that you absolutely had to finish all your homework before you could play outside. And my neighbor's son, they had the same deal. So we could all only come out to play with each other. And he was so good at math, right? And my mom would always, she would always remind me, well, you need to do better at math because Ryan is doing really great at math and he can do it in his head.
Love that.
So, no, he was really good. I could not compete.
Yeah.
But it was just a lot of that. I think we'd go over to each other's houses, study together, ride our bikes. One funny story I like to tell people is we had this dog, Coco, and he was such a baby. And I was little, and one time there was a cow and it started running towards me and I picked up my dog and I ran so fast. We fell after a certain point,
Oh God.
slipped and fell, but we got away and we were okay. So it was things like that.
Yeah.
Super simple, not
Yeah.
too complicated. Birthday parties, things like that. But
Good old
yeah,
days
yeah.
almost. I always, I mean, I'm not gonna force you to reveal your age, but do you feel that you made it out of the generation before like the digital age and social media got onto you? Because I feel like I had a perfect childhood. Like it was unobstructed by those distractions, you know. And just like you, I was in the neighborhood, you know. My wife now, like we grew up together, so you know, I remember we would be biking exactly what you said, competing against each other in school. She was way smarter than me, but having somebody push you in that regard, and that, like, you know, I feel like that's the pure part of life that we kind of are missing a bit these days, you know, especially with the younger kids. I don't know.
Yeah. Well, the digital age. I remember that Facebook started when I was in high school.
Yeah.
And
Did you have high five before that?
I wasn't allowed to have
Oh,
any
you
of it.
Berbice rules or
Mom
oh,
rules.
mom rules?
A few of
Okay.
my friends had like MySpace and things like that.
Okay.
And, uh, my mom would let us, free reign to use the computers, do whatever you want. But no Facebook and no MySpace until I think I was 17. And then my mom was like, okay, well, fine, you can have a Facebook account.
Yeah.
And at the time, I think I thought, well, wow, this is really restrictive and all my friends are doing it. But, in retrospect, it took a lot of pressure off, Now I'm like, well, okay, it didn't really make a difference to me that I didn't have Facebook 3 years earlier.
Yeah. Back to your career trajectory. So, you went to school. Sorry, you said you went to school in. You didn't say where you went to high school, did you?
Oh, no. Wow, we got
Yeah,
so distracted.
yeah.
No, so I went to Skeldon Line Pat Secondary.
Okay. What was
Yeah.
that? What was that experience like?
It was good. I can't say that I loved school. I will
Yeah.
be perfectly honest. So I loved learning. I loved science. I loved math. And I enjoyed learning so much. I don't think I enjoyed the structure of school.
The structure meaning.
Yeah, like having to wake up at a certain time, go to
Oh,
class,
gotcha.
one class after the other. I felt like that part was really difficult for me, and I didn't enjoy it. The teachers were really nice.
Did they contribute to the enjoyment of learning? Is that what was behind your learning, or was it like going to school to be in that environment with friends?
To be honest, when it came to learning, I was very introverted and intrinsically motivated with that.
Okay.
I think I learned my best when I would leave school and come home and do everything on my own.
Really?
Yeah. I didn't have to follow the strict structure of a class, I could learn and explore different things and ideas that, at my own pace. And I feel like I understood what I wanted to know and what I wasn't getting well enough to make those accommodations where necessary. It was nice,
Yeah.
going to school. I still know quite a few of my friends from high school, but no, I can't say that I enjoyed school. I'll be honest.
Interesting. Yeah. I just to quickly contrast, like my experience with high school, like I just loved it. Like I felt in high school that I was, and like I'm talking like 14 to 16, like conscious that these are some of the best days of my life. Like it's not, and granted I have had better days since then, but I mean like I just enjoyed it so much. I remember like I would be going to school, and then when the weekend would come, me and my friends would kind of be like, want the weekend to finish so we could go back to school, because it was just like this like, place where we would have fun with each other, but you're also learning and competing and pushing, and it was just nice. Like that was my experience, and but I totally relate with what you're saying too, because like obviously we're all different, and some kids for sure I just knew were like the dark horses where they would go off and would they would excel so much like when they came back, because they just put in that work at home and get in themselves, and just, they had just had something special. So it's interesting how like we sort of grow up with the different characters in like our our system.
Yeah. I remember at one point, my teachers were telling my mom that they were a little worried for me because I wasn't taking like extra classes and all the extra lessons and things like that. And I couldn't do it. I was like, Mom, I don't want to spend all day in school and then spend 2 or 3 hours after school doing even more school.
Yeah.
And it worked so much better for me to just come home and have a break and then do all the things that I needed to do.
Mm-hmm.
Yeah.
So you finished high school, you went to UG, did study dentistry. Is that
Yeah.
the
Yeah, it's a Bachelor of Dental Surgery. Yeah, yeah, yeah,
Bachelor of Dental Surgery?
yeah, yeah.
And then you went off to,
I was a little conflicted about what I really wanted to do. Um, Aesthetics for sure. I knew that even before I graduated. I had started looking into programs and
what was your idea of aesthetics while doing the bachelor's in
um,
dentistry?
I thought it was a really interesting way to like boost confidence
Yeah.
and help like see people feeling their best in their own skin. And it's like a step up from doing skincare at home and facials at a spa. It goes a little bit beyond that. Um, and I talked to a few people about it, and I remember the year before I started, or like two, actually, it wasn't that long before I started studying aesthetics. I remember talking to a friend about it, and I was like, like I'm a little conflicted, just because I wonder how seriously people would take it. And she was like, "Well, do you really want to be someone who just changes someone's appearance and gives them Botox and filler and makes them look like an Instagram filter for the rest of your life?" And that just, when I heard that, I was like, well, that's just not the way I see it, you know? Because when someone walks into my office, my room, I'm not just thinking about injecting their face, which is, a lot of what I do. That's basically what I do every day. But it's so much more than that. It's talking to them about their nutrition, about their skincare routine. Are they getting enough hydration? Are you wearing sunscreen? Anyone who watches this, who knows me, will know that the one thing I'm always telling people is wear your sunscreen. And there are just so many things that go into it. And I didn't want to be someone who does like a standard job where everyone looks like the same Instagram filter. I wanted to take the time to get to know each person and their journey, and really understand what it is that they're trying to achieve. Like, are you trying to feel a little bit more confident, and how can we help that? Um, what is holding you back, and what is the least amount that we can do to help you achieve that? Because that's my philosophy. The smallest amount of anything that I can do, that I can inject to get you to where you need to be, that's best, you know?
That's very important to know because it it actually answers a lot of the questions I was gonna ask you eventually. Because like you said, a lot of people think about aesthetic treatment or sorry, what's the, I don't want to get the term wrong.
So it's aesthetic medicine.
Aesthetic medicine.
Yeah.
So you could look at aesthetic medicine and people just see the front page stories, the headlines and the botched
Yeah.
procedures, and
Yeah.
it's but it's interesting to me because, and again, that's, I say people, but I'm talking about people who are maybe against it or not experienced enough with or familiar enough with it, because the market for the beauty market, or I don't want to call it beauty yet. Well, what would you call it?
I mean, sure, call it
Yeah,
beauty.
the beauty market is worth billions of dollars. So like there are a lot of people doing it.
Absolutely.
But just to go back to, I just want to finish our timeline of where you started and then
Yeah.
went. So where'd you end up going to school, going to college?
So I studied with the American Academy of Facial Aesthetics.
Okay.
Yeah, and I did my training and courses in Boston.
Which part of Boston?
So it was some parts in the seaport
Okay.
district, which I enjoyed
Okay.
very much, and because it's right by the water.
Yeah. East side.
Yeah, and I did my practical exams in the outskirts, in Waltham.
Okay.
Yeah. Yeah.
I asked because I did my I spent a year in boarding school in Sheffield, Massachusetts,
Oh,
in the
nice.
Berkshires. Yeah. So yeah, awesome.
Yeah, yeah. When I was there, I felt like I was in like Smart People Central.
Yeah, it's very
Yeah.
intimidating, right?
Yeah, yeah. You walk around and it's like, oh,
Yeah.
MIT, oh, Pfizer. Wow,
Yeah,
all the
yeah.
smart people work here.
Nice. And then so 4 years there, and then you came back.
No. The aesthetics thing was not like a full 4 years.
Okay.
Um, it's, I think I spent maybe 2 years behind that. And there is more to go. But I wanted to start practicing what I know. You can do certain levels and then move up from that. I don't think that I want to do anything that borders beyond minimally invasive. So, like surgery, for example, that's just
Yeah.
not a thing that I want to get into. So I would say, well, I mean, keep learning forever. But yeah, I'm quite content with sticking to minimally invasive. That's my goal.
Nice.
Yeah.
I like that. It's also, I just want to come back to a point you mentioned, like, or we spoke about, there's a huge market for this. Why leave somewhere like the US?
Yeah.
Whereas like that is the market essentially for this kind of, profession. There's so many people getting treatment, and, it's very influential there. Why come back to a place like Guyana of all places? You know what I mean?
Oh, I get asked this one all the time. I think there are people here who want to get work done.
Yeah.
And if they want to, then they have to fly out to the US. And why should they have to do that?
Yeah.
I wanted to be able to make it accessible here. And yeah, I mean, I have all the same qualifications, and it's doing essentially the same procedures, but I wanted to be able to do it here so that you don't feel like it's inaccessible. Like, I think one of the ways we can improve Guyana is being able to offer things that you otherwise wouldn't have here. And I think that was my goal. Like, I want people to be able to do it. And there are so many people who come to me like every week wanting to do this. And I think if I can be here and offer that to them, then that's great. That makes it accessible and in some ways more affordable, because then you don't have to hop on a plane to pay the same amount for a procedure, but you have to get on a plane and do it somewhere else and possibly stay 2 weeks just to make for your checkups and your aftercare. And you can get all of that done here. And so that's what I wanted to be able to do, to offer the same services, the same safety protocols, and just do everything in a really nice environment and just make it something that people can have here.
It's like it's an open market. It's like you're kind of pioneering in a way. I'm sure there are other people in the field for sure, but you're pioneering this industry, which is so nice to see. And this is why I love having people like you on, because it's like we got to talk about these things, because like someone else in a different industry that like traditionally would be non-existent in our local market, we need to think of what else can we bring, like with fresh faces, good energy. Young people need to like really get on that train of how do we attack this in a good way. Following up on that, you must have sort of a read on what the local culture is behind aesthetics or beauty, let's say. I'm assuming most of your clientele are women,
I would say
or am I
the
ignorant in my assumption?
well, there's a ratio. I would say the largest side to that are women,
Okay.
but I have quite a few men.
Okay.
Yeah, yeah, yeah.
Nice. So then, in general, like, what is the thought process behind getting your services? I mean, and again, yeah, not to, I know this, not to out anyone, or just on a general basis, like, like, what are people looking for? What are Guyanese people who come for aesthetic treatment? What are they looking for?
I find most people actually just want to look like themselves.
Yeah.
They want to look a little fresher, a little bit more rejuvenated, less tired. They maybe don't want to see as many fine lines
Yeah.
and things like that. But I have, a lot of people worry that, you know, oh, well, won't a lot of people come to you wanting to look the same or look like this influencer or that? But the truth is, actually, a lot of people, they appreciate how they look and they just want to maintain and sort of enhance that.
Yeah.
Yeah, yeah. So I don't think that I get like a lot of people coming in with like a picture of an influencer or something saying, "Oh, I want to look like this." That's extremely rare to me,
Yeah.
actually. But and if they did, that would actually be like that would actually be a red flag to me that I shouldn't be doing certain procedures for this patient. But no, most people actually they just want to feel a little bit better about themselves, and they enjoy their unique features and their unique beauty. They just want a little bit more confidence, a little bit more radiance.
Yeah.
So
Well, explain that to me in terms of like what kind of procedures do you do? Like, what's your, what do you offer? What can I come to you to make me rejuvenated, make me feel fresh?
okay, so two of the most common things I do are that people will be familiar with are Botox and fillers. Um, so Botox is so it helps with the main thing that helps with are fine lines that appear when we make certain facial expressions. And so what it does is, okay, so think of your skin as like this piece of paper, right? And under your skin, there are muscles, right? And each muscle has a different function, and they help to make facial expressions. Like, for example, when I do this, make a little frowny face, those are my muscles at work. And when you smile, those are also muscles at work. And so they're all just under your skin. And what they do is that they pull and stretch and tug at your skin. They crease your skin over time. Like every time I do this, see, so it's definitely creasing my skin. And so what happens is that your skin, I guess you could think of it as like this piece of paper. So every time you fold a paper, right, there's a little crease. Now, if you fold it in the same spot over and over and over again without giving it a break, without relaxing it in any way, then that crease eventually becomes permanent, right? And so what Botox does is that it relaxes the muscle a little bit to soften those expressions and prevent those muscles from pulling so harshly at your skin so that it doesn't make such a permanent crease over time.
Yeah.
Yeah, so that's one
Okay.
of the things. Filler. So filler is the main type of filler that we use, the one that I like to use most because it's safe and reversible, are made of hyaluronic acid.
I've heard about that.
Yeah.
In my research for this, yeah.
Yeah. So the hyaluronic acid in fillers is very similar to Well, we have it in our bodies naturally. Hyaluronic acid and collagen, they sort of weave together and support your skin underneath, right? It's kind of like framework for a house.
Okay.
And so they support your skin. Now, over time, as we age, um, our body starts to produce less and less. And so your skin doesn't have as much support. And one of the other things hyaluronic acid does is that it holds water, like it holds a lot of water to hydrate and moisturize your skin. And so hyaluronic acid filler, what we do is it's kind of like a little gel. It's a very soft gel. And depending on where you place it and what your goal is, it can add support to the skin in areas where your skin might have lost a little bit of support.
So
And
we
it
talking
can,
like neck area?
um, maybe a little bit in the neck.
Okay.
One of the most common places where I re-add support and hydration are actually like our smile lines.
Oh, okay.
Yeah. So right here and right here, there's no actual bone support right behind here. It's not solid bone. And so that's one of the first areas of our face that starts to lose a little bit of support. And because we're smiling all the time, it causes this line. And we want that line to be there because it's a natural part of our facial expression. And you never want to remove your facial expressions
Character.
because, it's how we communicate with people. It's how we show our feelings. And it's just a unique part of how we appear to the world. So you don't want to completely, diminish this, but some people will lose a little bit of support here, and just adding a little bit of filler there just removes that shadow, re-adds support, and you just look a little bit more vibrant and refreshed.
Yeah. And it's minimally invasive.
Yeah. So that is, they're all injectables. So it's injection only.
Okay.
Painful?
Painful?
Well, I do numb everyone.
Okay.
Yeah. I mean, if you're going to do a procedure, you want to be super comfortable.
Mm-hmm.
And so I numb everyone before we do anything. And that makes it super comfortable. Botox is actually just maybe stingy for 2 seconds. And most people don't even need numbing for that.
Yeah.
You can do that and walk out, be on your way, and go back to work. But filler, definitely numbing, especially because it's a little bit deeper, the injections, and you're actually depositing a soft gel as opposed to Botox is just like a teeny tiny bit of liquid because you're just delivering it directly to the muscle.
Yeah.
Yeah. And you're not trying to fill up space or anything. So yeah.
On a scale of 1 to 10, 1 being makeup, 10 being plastic surgery, where do you rate Botox and filler?
I'd say Botox and filler maybe like an 8.
Okay.
6, 7, 8, around that area.
Okay, so 6 to 8.
Yeah, maybe like a 6 to 8.
Yeah.
It's super comfortable and not at all. There are not a whole lot of complications.
Yeah.
To worry about. There's no downtime really. So the only reason I put it higher up on the scale is that they are at the end of the day medical procedures. And so it's definitely not something you could do at home or.
Yeah. No, I respect that, and actually that was I didn't really tell people, who I was interviewing, but I did strike up remember when I was messaging you before you came on, I was like, I really don't want to sound like a total idiot here, because I don't want to come and ask you these basic questions that So, which I'm fine with, but I want to come in a bit educated and kind of have an idea of where this is coming from, because as a man, I can't really relate. And not to say, like you said, men have these procedures done. Maybe I'll get it one day. Who knows? But I wanted to make sure I knew where I was coming from. And one of the questions was like, somebody asked me, I wonder like what a doctor in that field would say, where is this on the scale of of makeup to plastic surgery? Because we sort of maybe conflate the two,
Yeah.
what Botox and more invasive surgeries or whatever. But yeah, no, that's interesting. In terms of like the beauty standard
Hmm.
of people here, like I know you obviously have your limitations in your practice,
Yeah.
which is good. I mean, look,
Mhm.
and even if you are like a, for example, plastic surgeon or whatever, like that to each their own. Who am I to judge on
Mhm.
what people want? But where do you think the standard of beauty comes from these days? Because like surely there's a lot more influence out there. I know you
Mhm.
mentioned it yourself with like, you kind of, it's a red flag when someone comes and says, "Oh, I want to look like this influencer,"
Yeah.
you know? So I would assume that many people, the content or the information that they're consuming visually every day influences their perception of beauty, their subjective perception of beauty. How much on that do you think it is, and if it comes from other places, where else is this coming from?
Um, I would say one of the biggest influences on beauty is social media, actually.
Yeah.
There's just so much content out there, and everyone's doing it. Get ready with me, or, you know, well, this is what I look like. And maybe they're not totally transparent about everything that they did to look the way they do. And so I think that plays a big part in what shapes our ideas of beauty these days. I think it also depends on the age of the person that we're talking to. Because I guess, like with a lot of younger people who are definitely paying much more attention to social media, TikTok, for example. TikTok is like one of my worst nightmares.
Yeah.
um,
Why is that?
well, there's just so much unlimited content on this and that, and you like a simple example is with skincare products. One person will say, "Well, you should use vitamin C because it's like a serum with vitamin C. You have to. If you're not, you're doing it wrong."
But use this one.
Yeah, well, either this one or just this specific ingredient in general. Like they'll say, well, you have to be using it. If you're not and you're wrong, it's so much better than every other ingredient out there. And that can be a little confusing to people because everyone's skin is different. People have different skin types, and you have to take that into consideration when telling them like what products to use. And so maybe vitamin C might be a bit too strong for one person, but they'll see it on TikTok and they'll feel like, oh, well, this dermatologist or this influencer or this esthetician, it's just someone out there saying, well, this is a great product, and if you're not using it, you're doing it wrong. And
Do you think, sorry to cut you, do you think the influencer behind the product, whatever product they're pushing, doesn't necessarily have anything to do with their aesthetic? I mean, obviously, because they're doing it for money. Do you think that plays a role? Like, I mean, like, there's a lot of product pushing.
I mean, yeah, of course. I think that does play a huge role. And beauty companies, makeup company, well, the beauty skincare companies, they all know this. And that's why like marketing through influencers is such a big thing these days. It's it's a really effective way to deliver to a lot of people all at once.
Yeah.
And
Not to mention you also have an in-app filter slapped on,
yeah,
which is
yeah.
hardly noticeable these days.
Yeah, so I mean, I'm guilty of using filters too sometimes.
No, for sure. I mean,
but-
I'm not knocking it. I'm just saying, pushing a beauty product with a digital filter on is
yeah. So it's a lot of that, and the transparency might not be there, and so I find that a lot of times I spend a lot of time just talking through these things to people,
yeah,
and making sure they understand that, okay, just because you're not doing a 10-step routine doesn't mean you're doing it wrong, or doesn't mean that your skin is going to be in terrible conditions. Sometimes all people need are 3 steps, you know?
which are, tell me.
Oh, well, if I were to say like absolute essential, cleanse, moisturize, sunscreen.
Really?
Yeah.
Yeah. Interesting. Like cleanse twice a day. I mean, I've only been recently put on to skincare. Like most men, I just bar soap it. But then a couple years ago, my wife was like, you're getting old. Like, you gotta start paying attention. And, a lot of men, I'm not going to say all, because many men take care of themselves very well. And I actually I'm a bit envious of that. But I've recently started really trying with the skincare and the cleansing. And yeah, it's like, I feel like the older I get, it's been tougher, because like it's I probably like cleanse like 2-3 times a day because my face just gets really oily. But then I realize if you over cleanse, you
Yeah.
secrete more oil. So you got to moisturize, and I'm not disciplined with the moisturizing, and I'm not disciplined with my sunscreen. So it's like I feel like I'm sabotaging myself constantly.
Ooh, so I'm going to tell you a secret. If you have oily skin and you're cleansing and not moisturizing, that's not the best.
Not the
You do
best.
have great skin, by the way. Like, it reflects the light very well.
Thank you. It's
so-
the good lighting.
No, definitely moisturize after you cleanse.
Yeah.
Because after you cleanse, it's basically it'll remove some oils. You're trying to remove dirt, impurities, wash away some bacteria, things like that. But it does remove some moisture from your skin. So it's always good to
Put it back in.
Yeah.
No, and I've also realized how especially lately how serious the sun has been and
Oh,
that
yeah.
effect on your skin. I mean, crazy how like intense it can get, and people like working in construction or like out in the field, like even when I'm like in the field like shooting, like sometimes I think, wow, like I've been roasted today, like almost where I feel like it's not safe. Like I'm not that badly burnt, but I feel like the sun is just penetrating my skin, and I kind of, I'm like worrying, like, oh, this maybe later in my life this might come back to affect me.
Well, even if you don't burn, it is definitely still damaging. A lot of people with deeper skin, we tend not to have sunburn as much. It's sort of a scale on like your melanin levels and your skin tone, but some people will not have a sunburn.
Yeah.
They will have a tan, or their skin will get deeper. But at the end of the day, it's still very damaging. And the sun is definitely not what it used to be 20 years ago. I can say that.
It's that climate change. Yeah. But I don't know if you know this, but are people with like lighter pigmentation more at risk for skin cancer and stuff like that?
Yeah, they do tend to burn more easily.
Right.
And so they are at higher risk of skin cancer, certain forms of skin cancer.
Okay.
Yeah, skin cancer is actually pretty common. And, I encourage everyone to wear your sunscreen. When you come, like, for example, everyone who comes through me, a few questions I ask, what's your diet like? Are you getting enough hydration?
Yeah.
And are you wearing sunscreen? Because everything I do will work so much better if these three things are.
Diet matters that much?
Yeah, absolutely. People might not have an allergy per se, but they do tend to be sensitive to it. Like dairy is a big one. I find that a lot of people, they'll break out a lot more if they have dairy.
Really?
Yeah, yeah.
Thought dairy was more of an IBS thing.
Well, it is. It
Yeah.
is. But it's also an acne thing.
Okay.
Like, yeah. I sugar, like added sugar, of course.
Definitely.
Sugar is very inflammatory, and so I would say if you want to have sugar, the best way to get it is through fruit and food, and maybe ease off certain,
Yeah.
like maybe lower the soda contents. One of the reasons I'm so glad my mom was like, no soda.
Yeah. We are a pretty sugar heavy culture though, in terms of food. A lot of
Yeah.
soft drinks, a lot of pastries, I guess.
Yeah.
Yeah, heavy stuff. Heavy stuff. Nice. Well, I want to go back a little bit to the business of medical, like, well, aesthetics. You have your own private practice?
No, I work at a private practice
Okay.
as an associate specialist. So I work with Dr. Sengupta and Associates.
Okay.
Yeah,
The
in
dentist.
Queenstown. Yeah,
Oh,
yeah.
nice.
And so it's really nice. There's a whole team there, and everyone is, everyone has their thing that they're good at and they enjoy, and so we all sort of refer to each other. We discuss cases. It's really nice to have a good team.
Yeah.
Yeah. One of the reasons it's also nice to work with a team-based practice is actually Botox Botox is, first of all, it's a brand name, but it's what everyone knows it as. There are a number of brands. They all do the same thing, but just putting that out there.
Yeah.
It's actually very effective at treating a number of things that aren't cosmetic.
Okay.
Yeah. For example,
So you do non-cosmetic procedures
yeah,
as
so
well?
I also trained in doing treatment of pain and what we call TMJ disorders. Like a lot of people actually, I do it personally. A lot of people will grind their teeth or
Oh, I
clench,
used to do that a lot.
especially when they're stressed and sometimes unconsciously. And what happens is that the muscle will sometimes, it's just like any other muscle. If you go to the gym and you work out, muscle will get bigger and stronger. And so the same thing happens to your muscles here. And it starts to deliver so much more force. And for a lot of people, the muscle gets really tense and really painful. And there's another big muscle on top here, and it goes all the way here down to your jaws here. And it does a very similar thing. It closes your jaws. And so those two muscles are usually pretty active when someone is like grinding their teeth a lot, and they usually end up in a lot of pain. Some people will crack or chip a tooth, and some people will just wear away their teeth.
Yeah.
And so Botox does very similarly to what it does to the other muscles that you inject it to. It relaxes the muscle. Of course, these muscles are bigger and stronger, and they usually, if you're doing it out of habit, then it's working over time. So they usually require a bigger dose, but it relieves the pain, and usually it restores the muscle back to its original size over time.
Yeah.
Yeah, that's actually something I do for myself.
Oh, nice.
Yeah, because I don't grind my teeth, but I stress clench a lot, and so I tend to get a lot of headaches with it.
Yeah.
And it sometimes, like, it used to get so tense that if I were eating something really simple, like, my jaws would feel so tired, and it's the same for so many other people who
Yeah.
do this.
Yeah.
So that's one of the things it's really helpful for.
Yeah. Wow.
Yeah.
I didn't even know they were that was in the field of
Yeah,
what you do.
yeah. And since I work in a dental practice, we see that a lot.
Yeah.
Yeah, and so
So you'd get some of the spillover for those kind of cases, I guess.
yeah. I mean that's one of the benefits of working with a team. Like we all like if there's something that uh, a patient needs, I definitely don't do any general dentistry,
Yeah.
but someone else in the office does.
Yeah.
And
Specialized care.
yeah, and so they have access to everything they need.
Yeah.
Yeah.
The market for young medical students, like perhaps like you, who are like a bit more specialized in non mainstream practice, let's say, how do they start their careers? I assume it's very capital intensive to start that on your own as a private practice.
Yeah.
So what you're
Absolutely.
doing is kind of like it maybe offsets a bit of that being attached to, yeah.
Yeah. Well, I mean, aside from it being like enormously expensive to just set up and start on your own, I mean, you'd have to make sure that you have a great team, administration, everything, biohazards, sterilization, all of that, just making sure that everything is like perfectly tuned to all the safety practices. And I mean, as great as it is to own your own business and own your own practice, it comes with a lot of responsibility that I think some people don't always think about off the bat.
Yeah.
And I really wanted to be able to focus on doing what I love and doing it really well and having a system in place that supports that.
Yeah.
Rather than trying to run my own business and make sure that everything's okay and also do what I love and do it well. So I know it seems a little bit like the easy way out for
Not
now,
at all.
but it's
Not at all.
I'm very happy to like my team is great. I couldn't possibly work the way I do without them, and like I'm so thankful for that. So yeah, I mean, it really just allows me to show up for my patients in the best way possible and not have to stress about everything else.
Yeah. No, first of all, not at all. I asked that question because it's like, you spend umpteen years
Yeah.
doing a bachelor's, then medical school, and then the last thing you want to do is to get out of that, which is, pretty costly.
Yeah,
Then throw along more capital on equipment and human resources
exactly.
to then have to worry about all of that and not focus on what you've been studying for the last 10 years. So, and it's a testament to collaboration in a growing economy, and it fascinates me. I love talking about like, what is your like business experience with like people such as yourself in these unique fields, because there's a strategy to doing it. It's not just sort of like, well, I've done this, so I'm now entitled to all this support that I need to be a successful entrepreneur. And just to, for me at least, like it took me a couple of years before I kind of did it the other way. I felt the burn of, not managing a business properly, because that just comes with so much headache. You can't just always be, whether you're an artist or a specialized doctor or whatever, you just need that support system to run an effective practice. And yeah, I mean, I'm sure though, like, 5-10 years down the line, you'll have way more experience and eventually probably, if you want to, be able to do it on your own. Like, it's a good blueprint to have.
Yeah.
I was wondering, one question that was on my mind was for the need for the demand for like aesthetic procedures to be done. What's the influence of non-Guyanese in the market? I ask that because I know we have a lot of like migrants here, from like Brazil, especially, with who I know is like heavy into like aesthetic procedures. Not necessarily what you do, but other things as well. Like, like,
Mm-hmm.
do you have like, is there like a growing market there with non-Guyanese?
As in like my patient base
Yeah,
or
or,
oh,
or just in, well, they don't necessarily have to be your patients, but like people who are looking for that kind of thing.
well, yeah, I find that it is growing. And there are just a lot of people interested, both Guyanese and non-Guyanese. I'd say it's definitely a mix of both because a lot of Guyanese are interested in getting stuff done, and they want to know more and they want to do things. And then, of course, there are lots of people who come to Guyana and they're like, well, I used to do this in, whatever country I was living in before, and I want to still keep doing it. And now I can. So
Yeah, it's
it's nice.
accessible.
Yeah, yeah.
Yeah. Do you think there's room aside from your field for more like different medical personnel to come down and fill other gaps? Like, because you're in the medical field, and I guess like I ask this as a man who who has thought he was invincible for a long time, and not I never really, knock on wood, never had like a health scare or something serious. I've had problems with like, I always tell myself like my health insurance is running on the treadmill, making sure I get in like some sort of exercise, my body's functional. But I know like, there's there's things that people need that aren't readily accessible here. So like, what in your experience, like what is there a need for in the like medical field that can go a long way in our society? And it doesn't have to be aesthetics. It could be like,
Like,
thank you, GPL, for that sudden power outage and pitch blackness. How classic. I'm sorry about that.
oh no, no worries.
I'm embarrassed on behalf of GPL.
Oh, you have no need to be.
Yeah.
That's known to happen occasionally.
Okay, more than occasion. You're being generous. You got some kind of deal with them? You here to promote them or what?
I wish. Oh my gosh.
Yeah. We were just talking about the fact that there's a lot of gaps that can be filled in the medical procedure field.
Yeah.
You said, you were telling me that many times people have to send results away or even go away.
Yeah.
I mean, I was recently with my mom in the US, which is a total like unaffordable. I first of all, I just want to divert this conversation quickly.
Oh, absolutely.
And I need to say that I am, and this is not a jab at like our medical professionals who like go above and beyond to help people, and they have my eternal respect and gratitude. But I think our capacity, the system is so like overwhelmed with, people who aren't maybe, we don't have enough like super competent people or people that, can really fill in for like emergency situations and the need for people who need treatment and Medicare, so it really scares me getting sick because I'm not sure what I would do. And I've also had like some less than ideal experiences with our, local Medicare. And so it kind of like, for me, it's like a 50-50. And I understand that like, it's the case in a lot of places, but I think like in Guyana, we have a ways to go. We can do better. I'm not sure how. I'm no expert, so I don't want to self-righteously sit here and just criticize and not offer a solution. But for me, I'm always scared about getting sick because, one, I know, like for example, if it's an illness or something that's wrong that can't be treated here because we don't have those the medical capacity in whatever regard, I also can't afford healthcare abroad as well. That's also could be an issue.
Yeah. I feel like if we started talking about that, it would be hours long discussion. But yeah, sometimes it's like a few simple certain tests. Like one of the things that and I'm sure many people are seeing more commonly these days are autoimmune disorders.
Yeah.
Yeah, inflammatory and autoimmune disorders. I myself struggle with one of them, and I have for years. Um, and the test, the autoimmune antibody test, I it still has to be sent out of the country.
Oh, no way.
Yeah, yeah. And I mean, that applies to, I think, every hospital, and whether public or private. Um, and, that's, first of all, it's an expensive test. And second of all, it's really tough when you're having a really hard time and in a lot of pain, and you want answers and you have to wait a really long time for it.
Yeah.
Yes.
That's almost even like adds insult to injury, because it's, it's just away and you're there in no man's land.
Yeah. It's tough, and as someone who, um, I mean, I do my best to stay healthy. Like I exercise every day. I try to eat. I'm very disciplined with how I eat. But as someone with like a chronic health condition, I do recognize that sometimes, no matter what I do, I'm gonna have really hard days, and so I'm like you in the case that I try my best not to be really sick, because if I do, then it becomes so stressful, and I myself, like, this has actually been like one of the toughest years for my health. I got really sick really quickly, and I didn't want to have to leave the country, but eventually I did. And it was stressful, and it was tough because I had to take so much time off work, and my mom was with me for a little bit, and it was just a lot being in a completely different place and having to be away from my my main support system, my mom, my dad. And I mean, I'm glad that I could have done that, um, because it's a really huge privilege to have been able to do that, and
Absolutely.
to be be here, having this conversation and talking about it, to just be alive and well, and to have been able to access the care that I needed. And so sometimes I think about it, and I do feel a little worry and guilt about that. So
Yeah.
I want it to be better. And I think, um, it has some ways to go, and I do hope that it goes in the right direction.
What do you think would be the, because you and I obviously share these sentiments, and it is a privilege to be able to not afford healthcare abroad. You know what I mean? Like
Yeah.
to say, okay, I'm gonna, at the very worst, I'm gonna go abroad and then either incur massive debt, or do whatever I have to do to gather all this resource to get treated or whatever. Imagine people who can hardly afford to travel
Yeah.
to do that. So like, what do you think it would do for our population if we increase the confidence in the healthcare system by like 40 to 50%?
Oh my gosh, that would do wonders for people.
That would, to me, that would like transform our society.
It absolutely would. The thing is, I think I know so many really great doctors and so many people who love their patients, and sometimes it's just overwhelming, because it's like one or two or three doctors and so many people, and so I think, and it's also like really tough because, for example, where I grew up, where I'm from, Skelton, for example, there are certain healthcare resources that just aren't there. And so someone would have to leave there and come all the way to Georgetown. And so, it would be really great if people could access everything that they needed to there.
Yeah.
And only maybe if there's a huge specialty care need that they absolutely had to, that they'd have to leave. And
Skeldon is an interesting example because like we were talking about, there are many places like that around the country outside of Georgetown. Berbice obviously has a massive population.
yeah.
It kind of baffles me that you got, so many people living in Berbice, but and it's getting better for sure. But there's not like, in my opinion, Berbice should be like the next Georgetown. You know what I mean? Like it's like, and that's not a knock on Berbice. Like it still has its own character, but I just mean in terms of like the resources.
Yeah.
So something like you said, like there's not even current days, somebody who needs treatment would have to move from Skeldon to Berbice, travel 2 hours, and then sit down in a doctor's office
Yeah.
behind a line of 10 other people, maybe get seen at the end of the day because this doctor's in high demand, and is the only person that's able to treat their ailment. In your opinion, and as a young medical professional, how do we get like doctors into those areas? And I'm not saying, I'm not necessarily even talking about like, I'm not comparing it to like areas like deep hinterland and that kind of thing, but like places like Berbice, like over the West Bank, for example, or Linden, let's say. Like, how do we get doctors to go there? Is it like infrastructure, or do we need like a better economy there? I'm not expecting you to have the answers, but what is your opinion to like get more like qualified medical personnel out there?
Well, a few things come to mind. The first is I think a lot of people, especially when they're young, um, they're not just looking at, okay, well, is this a great place to practice and see patients and learn more? They want to know what their life is going to be like there. And so I think it also makes sense to develop the area as a whole, not just for the people, but for the people that you want to position there to take care of those people. They have to want to be there, and they have to want to feel at home and enjoy it. And so I know a lot of people might say, well, they don't want to go to Berbice because it's boring and there's nothing to do. And so, well, then let's create some activities. Let's make some things to do. Doesn't have to be the same things that are in Georgetown. In fact, I think there are lots of really unique things that you can make possible. But just make it possible.
Yeah. No, I hear what you're saying. And again, I don't expect you to have the answer because we're both like thinking through this, right? I mean, like you're a doctor. It would be nice to go to a cafe, get a coffee, like, go to a nice gym, have a workout, like maybe, on the weekend, go have some drinks with friends. Like, and I'm not saying Berbice doesn't have these things per se, but the economy should be better. It should be, I don't know if it's like maybe the generic population there may not have the disposable income for these things, or whatever the case may be. I don't want to, pronounce on it, but I totally get why.
Yeah.
And this is not only applicable to doctors as well. You need other expertise, like people who have invested in their profession and can also service these areas,
Absolutely.
And I think that's where the conversation we need to have going forward. How are we getting more people out there?
Yeah, and I mean, aside from that, I think one of the things to look at is actually the emotions behind it, because if you are asking someone to leave a place that they've lived their whole life and go somewhere else, well, what's in it for them? Like, they're leaving behind maybe their family, their friends, everything that they're used to and everything that they've known. And some people are really adventurous in that they're like, okay, yeah, I have no problem doing that. And some people are not that adventurous. So they're like, well, why should I have to leave this behind? Like, what is there to support me? You know? And so I think those are all things to think about. Like, you kind of have to make it a space where they also feel like safe and happy emotionally, because at the end of the day, for example, if it is a doctor, they are going to be seeing patients, and you don't want someone who's um, unhappy deeply, and then they have to look at maybe 10 to 20 people. That's an immense load. And you're not just looking at someone's medical care. You hear their stories, and they'll talk to you about everything. And so then you're taking on, you know, if you're a person with compassion, as most people are, and then you're also taking on their stories. So you know, it's a lot to think about, and there are just, you know, so many angles and so many things to consider.
Yeah, no, and thank you for sharing that. Like, it's so wonderful to hear your perspective, because I can sit here and think about all the things we need to do, but it's just like, this open communication is what drives the thought forward.
Yeah.
I appreciate it. Just a couple questions in closing, like, as a young professional, like, what do you see for Guyana moving forward? Like, as someone who's like in the going on to the energizing, or in the energizing part of their career, like, how do you feel about the future of Guyana as a medical professional? What are your thoughts on this?
Personally, I'm really excited.
Yeah.
Yeah, I mean, I love what I do, and like the best part of my day is just knowing that there are patients who are going to walk through the doors and are interested in what I have to offer, and interested in making that connection and developing just a long-term relationship. Like, 'cause that's essentially what it is someone who's caring for them. And I just think it's great. It's nice to know that there are people out there who are interested in what I'm doing, and they want to access it. So I'm super excited.
Yeah. And my last question would be, I want to go back to that thing you told me about your friend telling you, "Oh, do you really want to be this person that just does these filter faces?" And I say that, no offense to your friend. I'm just asking this because I know our culture and our society can be a bit, and I mean this in the most loving way, can be a bit ignorant with regards to new things we're uneducated about, uninformed about.
Mhm.
You know, you're talking to like a little girl, who is in your shoes, looking to pursue something new because that's where her passion is, and that's the sort of career she wants to drive for herself. What is your advice to someone like that coming up, looking to pursue her dream in a field that is potentially not welcomed with open arms due to the society being uninformed?
Well, I'll tell you how I thought about it when I was making my decision. You know, even though that was something that was said, the Instagram filter face thing, I thought about it, and it was like, well, that's not, that's actually not what I want to do, and it's not the philosophy I want to have with, or the approach I want to have with how I care for my patients. And so I think just understand who you are, what your values are, and your approach to it. Everyone has a very unique approach to what they do. If you talk to someone else who's doing what I do, they might have a different approach than I do. And so just don't diminish that you might have a unique approach or perspective to add to what you do, and be able to deliver that and have people who connect to it and who it resonates with. And, you know, as for a lot of people misunderstanding, well, there's always going to be that. Personally, one of the ways I tried to combat that was actually, so When I first started practicing, and actually up until now, I did not do any kind of advertising. I know that sounds counterintuitive, and it's like, well, you're doing this. You want to have a lot of patience? And I think what I really wanted to do was spend the time uh, developing the relationships and having people understand, well, this is the approach and philosophy that I have, and well, this is what it's actually about, and let's talk about what you might not understand, and let's under let's really try to understand everything. And so my focus was just on making sure people understood my philosophy and just on educating them. And I didn't try to put out a lot of ads or anything like that. And I think that really helped to um, cement what I stand for as a doctor, because now when someone is referring another person to me, they're like, well, oh yeah, she's not, well, this is her approach. And you don't have to like worry that she's going to make you look like a Kardashian or something, because that's not her approach. And so I, I think, connect with the people and have them understand what your values are, your approach is. And there are people who it will resonate with, even if it's a little different.
Nelece, thank you so much for coming on. It was such a pleasure talking to you. I feel like, we connected really well, and I would love to have you back someday.
Well, thank you for having me. I really enjoyed this. Yeah.
Fantastic. Thank you again.